Hey people, it's Niall Stokey. Now this is for the New York Times. New York must offer vaccine to all prisoners immediately, judge rules. A judge in the Bronx ruled that people incarcerated in the state's prisons and jails have been arbitrarily excluded from the coronavirus vaccine rollout. New York must immediately begin to offer COVID vaccines to all incarcerated people in the state's prisons and jails, a judge ruled on Monday, making the state one of the few in the nation to provide doses to such a broad population behind bars. The order, the first involving any of the country's largest correctional systems, comes as the coronavirus continues to roar through facilities in New York. At least 1,100 people living behind prison walls have tested positive for the virus since the start of the last month, and 5 have died. But even as correction staff and many other groups, including some who live in close contact settings like group homes and homeless shelters, have gained access to the vaccine in recent weeks, most incarcerated people in New York have remained ineligible to receive doses. Justice Alan Y. Tuitt of State Supreme Court in the Bronx wrote in her ruling on Monday afternoon that people in prisons and jails have been arbitrarily left out of the rollout, and that doing so was unfair and unjust and an abuse of discretion. State officials, he said, irrationally distinguished between incarcerated people and people living in every other type of adult congregate facility, at great risk to incarcerated people's lives during the pandemic. She added there is no acceptable excuse for this deliberate exclusion. Governor Andrew M. Cuomo's office did not signal an intention to appeal the decision and said in a statement on Monday evening that eligibility would be expanded to all people behind bars as the judge ordered. Our goal all along has been to implement a vaccination program that is fair and equitable, and these changes will help to ensure that continues to happen, said Beth Garvey, acting counsel to the governor. Epidemiologists and infectious disease specialists widely agreed, even in the early stages of vaccination efforts when supply was more limited, that the roughly 50,000 people in correctional facilities across the state should be made eligible because of their uniquely high risk for contracting and spreading the virus. A disproportionate number of them are also Black and Latino groups that have been hit hard by the pandemic. But vaccinating incarcerated people has proved politically forward across the country as states grapple with the same ethical, logistical, and legal questions that have drawn up drastically different timelines for offering doses. In New York, most of these groups behind bars have been left out, though other high-risk groups like restaurant workers, public-facing government employees, and essential building service workers recently became eligible. Florida has not yet made people in state prisons eligible, while Texas and Arkansas announced last week that they would start providing doses to some of those behind bars. Some other states, including New Jersey, began inoculating incarcerated people late last year, just as the first vaccine doses were being made available. And in Massachusetts, roughly 6,400 people have already been offered a vaccine. In a similar suit last month in Oregon, a federal court judge ordered the state prison system, which has a population of around 12,000, to offer doses to all incarcerated people. It was the first successful legal battle of its kind nationwide. Hours after the lawsuit in state Supreme Court in the Bronx was filed early last month, state correctional officials announced that incarcerated people aged 65 and older, who make up roughly 3% of the prison population, will be offered the vaccine. Around 1,100 detainees in New York City jails, many of whom were at the highest risk of complications for infection, also received doses starting in the first week of January. In recent years, the state's age threshold for eligibility was lowered to include anyone 60 years of age and older, and then 50 and older. People with some chronic health conditions were also allowed to sign up for vaccination appointments. State officials announced on Monday that all adult residents would be eligible to receive a coronavirus vaccine by April 6, which might have led more people behind bars to soon be offered doses even had the ruling not been issued. Inside prisons, roughly 3/4 of the 1,066 incarcerated people over 65 opted into receiving shots, a spokeswoman for the state corrections department said last week. More than 2,500 people with eligible conditions also received their first doses. Still, public health experts say that incarcerated people, regardless of age or condition, should have already been made eligible since they often live in congested units and eat in crowded facilities where social distancing is nearly impossible. It's a population that should be at the top of the list, said Dr. Wafa El Sadar, an epidemiologist at Columbia University's Mailman School of Public Health, said in an interview in January during the first week of the state's rollout. I can't think of an insurmountable barrier, in all honesty, to getting it done aside from stigmatization and discrimination. Center for Disease Control and Prevention recommended offering doses to everyone at correctional facilities simultaneously. Public defenders and civil liberties group noted in their argument. Prison and jail workers across the state were made eligible to receive the vaccine on January 11th. Efforts to place incarcerated people ahead of the general public in the rollout have drawn pushback from some lawmakers in other states. The state Senate in Kansas, where the majority of members are Republicans, passed a non-binding resolution that demanded the governor revise the vaccination plan that prioritized those in prisons. Colorado backtracked on a plan to give prisoners early access to vaccines following opposition from Republican lawmakers and on social media. And in New York, Republicans in the state Senate and Assembly had raised concerns over vaccinating incarcerated people before fully inoculating essential workers. Several advocacy groups plan to now focus on continued education and outreach around the vaccine. Some incarcerated people, they worry, may be reluctant to accept doses, largely because of the government's history of medical experimentation on prison populations and people of color, and the dearth of information available to people behind bars. Still, the order came as a welcome source of relief for family members of incarcerated people and those awaiting their turn to be vaccinated. Alexander Del Priore, 26, is incarcerated at a state prison in Fulton County and has type 1 diabetes, placing him at higher risk for serious complications from the virus. His mother, Robin, said he was recently offered a vaccine, but prison officials told him he would have to relinquish his place in line for a work release program. Ms. Del Priore said because they claimed it might prevent him from being present to receive his second dose. Her son declined the vaccine in order to keep his spot, she added, even though he wanted to be inoculated. The rollout's lack of focus on those behind bars had left lasting frustration, Ms. Del Priore said. Why are we picking and choosing who's deserving? Who gets to be judge and jury on that? Saying you deserve it, but you don't, Ms. Del Priore asked. How is that right? I hope you enjoyed that. Please comment, rate, share, and subscribe. I'm going to leave this article and some more in the description. Peace.